Good afternoon, everyone. When I say good afternoon, those who are awake and alive, they respond back. Good afternoon, yes. So, I'm thankful to organizers for giving me opportunity to speak. Usually on Sundays, I'm at home and it is difficult to speak. You know why? Because I'm married. And a big round of applause for my panelist. See, in conference or any CME, the law comes last. But in your practice, keep it first. That is the only request. So, these are the panelists, Dr. Sandip Trivedi, Dr. Tushar Shah, Dr. P.N. Tiwari sir, and Dr. Kirit Sisodiya sir. So, good big round of applause, and we will start with certain general queries on Medicolegal. So, I have divided it like this: general medico-legal questions, the questions regarding documents and consents, indemnity insurance, and situational questions. And let us see how far we can reach. So, general medico-legal questions. That is, first you should know the basics of the law, then it is easy to understand the further things. So, what are the two main systems of the law? Sir, any of you can take this question. Like, what are the main two systems of justice or law?
Two type of the law.
Yes. What are the two systems?
Yeah, two system is there. One is criminology and one is the routine consumer protection.
So consumer or yes.
Civil and criminal.
Criminal.
Yeah.
Very good. So civil and criminal are two systems of law. You understand that? And why the difference is important? Sir, why this difference is important to understand?
In civil, there is the no punishment is there. Only you are compensate the loss.
Perfect.
But in criminal, you should be go for the punishment.
Very good. And what is punishment? Punishment is imprisonment, jail. So whenever a criminal law comes into action, there is a jail. That is the only thing, or you are acquitted. And in civil or consumer is a part of civil. The ultimate outcome will be some amount of compensation which ranges from few lakhs to few crores in present time. Sir, when do you know that it is a civil case or a criminal case? How do you know?
In civil case, there is a failure of the exercise. Matlab, there is a minor mistake.
No. How you will come to know that it is a civil case or it is a consumer case?
There is
a criminal case.
If there is a no major negligence and any loss like a failure of the diagnosis sometimes, and diagnosis is delayed diagnosis in medical practice and patients suffer, and they made the file for the compensation.
Yes.
So from this is compensation in the court, they can do in the court in Consumer Protection Act, and they do civil suits also.
The shortest answer will be from the paper which you see, from the court, which court it has come, right? If it is a consumer court, it is a civil case.
Yes.
If it is civil court, it is a civil case.
Yes.
And what you get for criminal case?
For criminal case, there is a gross negligence.
No. What you will get? What will come to your place?
Summons FRI from the court. FRI, police FRI.
A magistrate court.
Yes.
You understand that all the summons are basically coming from the court. But if it is a summons from the magistrate court, sessions court, or police officer comes, that is a criminal case.
Yes.
So whenever you see a person in khaki dress at your doorstep, it is a criminal case. And you have to alert your brain that you have to come out of this. Today, just now, before entering this hall, I got one case where a doctor was implicated, and what is very important to understand which criminal case, because there are bailable case and non-bailable case. You know what is bailable and non-bailable? Yes.
In bailable case, you are grant the bail, and before any punishment, or in Gujarati, dhad pakad, doctor is going to the court and take the bail. In non-bailable is not granted the bail, but bail granted by the court if fact-founding committee is there and the court shows or judge shows that this is the not serious matter, and then they give the bail.
So, in bailable offense,
Yes.
Bail is a right.
bail is a right.
Yeah.
Bail is a right. That means police officer will not arrest you. He will just give you bail. While in non-bailable, you have to go to the court to get the bail. So what police officer will do? He will put you behind the bar on Friday evening. You are there in jail or in police custody from Saturday, Sunday. Monday you will go to court and you may get the bail. So what I did, I told that doctor to run away. I said, you run away. And Monday I will file anticipatory bail and I will present you. So, and understand one thing. This is very important, carry home. Patient has died. Now, if doctor is found at the nearby body or doctor is found somewhere else, it doesn't make any other offense. Hit and run is the only case where you can't kill somebody and run away. Otherwise, even if you found somewhere else, the punishment is same, even if it is going to be some punishment. So don't find or don't be present at the dead body. They will arrest you there and then if it is, they consider it as a non-bailable offense. They put it in a non-bailable offense. And if that is so, then always run away. There is nothing wrong in that. It is a normal human tendency, but we have fear and we stand there. Even mob will hit you and police will arrest you. That is the ultimate outcome. So you have to run away and there is no additional punishment for running away. So that is what I wanted to tell. Then, as long as audience is not in sleep mode, I am okay. No, it is open only. I don't know. Okay, fine, no problem. कानून की आवाज बहुत लोग दबाने की कोशिश करते हैं. This is one such incident. So bailable, non-bailable is over. Now, what is gross negligence versus ordinary negligence? Sir has already said, gross negligence is something which no other doctor will do. That may lead to a criminal case. And what is civil case? Where a minor defect. Sir, Tiwari sir will say something about the minor defects or how the consumer courts will look at the case. Please, sir.
Thank you, Moderator, sir. I am Dr. P.N. Tiwari, member judge in Consumer Court. Now I am retired. Now, as far as the consumer matter is concerned, here the civil liability is there, irrespective of the damages. Whenever damage is there, patient can go to the criminal or he lodge the police complaint. But after investigation, it is seen that it is in civil nature, the case is referred to consumer court. And consumer court, there is no issue of any warrant or some notice until unless a case is filed. So damage may be of any extent, right from minor injury or death on table. After investigation, it is decided whether it has to be proceeded in a criminal court or in a consumer. The thing is that in a consumer or our court, we only award compensation depending on the length of the damages. We don't consider everything in detail and there is no more requirement is there, only a damage limit is there and that damages has to be proved by the patient, not by the doctors in a first stage. So on that basis, the consumer courts take action.
So in criminal law, there is a dictum. भले 100 गुनेगार निकल जाए, एक निर्दोष को सजा नहीं होनी चाहिए. Or everybody is presumed innocent unless the opposite party proves it beyond reasonable doubt. If you create a doubt, you are out of a criminal case. There has to be some other possibility. ये patient शायद heart attack से भी मरा हो. मैंने तो सिर्फ appendix किया था. If there is some doubt, you are out. But in civil, it's different. Like as sir has said, if there is a balance of probability, there is some possibility that there is some negligence from your side, the case will be decided in patient's favor. And ultimately, the punishment will be some amount will go to the patient. Sir, what is ex parte hearing? Ex parte hearing. Yes, you can take, sir. It's a civil case.
Please, Tushar bhai. Tushar bhai, please you continue. I'll conclude.
Yes. See, when you don't respond, right, many a times you don't get the notice. And there are cases in indemnity insurance itself where the lawyers are allocated, but lawyers don't attend the court. And when they don't attend the court, the judge will pass the order ex parte. That means just hearing the opposite party, they will pass the order. That is ex parte order. And it happened in Maharashtra. Doctor opened his newspaper and he read that 50 lakh rupees award was passed against him. And he said, where? I don't know even. He asked his advocate. He said, what happened? The award is passed. Then the advocate was asking that, sir, कहाँ लिखा है वो? बोले आज के newspaper में. बोले sir, मैंने वो भी नहीं पढ़ा है. They don't even read newspaper. Sometimes such lawyers are there. So you have to be very careful whenever there is a case. Be behind the advocate. You have to just check that at what stage the case is. Can I refuse to treat the patient?
Yes, provided it is not an emergency.
Perfect.
So in emergency, you need to stabilize, then can transfer. But if there is no emergency, you can refuse the patient depending on the thinking that is your. Of course, you do it smartly.
Sir, you want to say something? Yes.
Sometimes if patient in non-emergency case, patient is refusing to pay the fee to you, you can also refuse, but in non-emergency case.
In non-emergency.
If you having expertization in particular the patient, then you can also refuse that.
So it is like if patient is not in emergency, you can refuse. If there is emergency, you have to give as per Parmanand Katara's case where Supreme Court has said you have to give primary treatment and then refer the patient to a place where the treatment is available. But there is one catch here. Refusing means if patient is coming for the first time and if you refuse, it is perfectly fine. You have started some treatment, in between you say no, then it is little difficult, little tricky. And once you have started some exhaustive treatment and then you say no, it is like if you are girlfriend, boyfriend, you refuse to marry, perfect. You just engage, then to say no for marriage, it is more difficult. Once you are married and now you want to separate, much more difficult. It is same like that.
Sir, in addition to this, once a patient arrives before you in your clinic or emergency room and you have decided not to examine or treat, and you say, no, sir, we are referring the patient, you take to the other hospital, right? So it is just washing your hand. No, it is not. The liability is on your head. You have to shift the patient in a proper way.
That is once you start the treatment.
Yes.
No. Even if you have not given any treatment, that is different issue. But as far as Hitesh Bhai has mentioned about the permanent Katara case, irrespective of your specialty, you have to give some treatment and refer the patient to the concerned.
But in emergency, Parmana Katara was for emergency.
Only in emergency.
For cool case, it is allowed.
Only life-threatening condition is there, then you should treat or something treat and explain and
Yes.
refer with the support.
Yes. And if it is life-threatening to you, then also you can refuse. There is a case like which you must have seen in newspaper from Rajasthan, where one orthopedic patient was treated, and then that patient was taken to Gitanjali Hospital. At that time, Gitanjali Hospital is some hospital where we are advising them. So we said that you can refuse. You can always say that these relatives are actually very assailient people. They can assault us also. And we don't want to put ourselves into life-threatening situation. We don't want to treat this patient. You are within your rights. Nobody will force you to treat somebody by putting your life into the risk.
Absolutely.
So I think we'll skip this document part. If time permits, we will go there. Let us go to the situational questions first. And then we will come to other questions. So situational question. Can a doctor issue death certificate?
He can issue provided he knows the cause of death and patient is under his treatment. So suppose patient is not under my treatment and somebody just comes for a certificate, not a good idea. If I don't know the cause of death, not a good idea. If child comes, is brought dead, then definitely you don't know the cause of death. No. So you have to issue or you can issue if the child is under your treatment and you know the cause of death.
Perfect. Anybody wants to add anything in this?
If sudden infant death is there and patient brought dead, then you can't issue the certificate. Like Tushar Bhai said, you are not knowing the cause. And other suspicions, just strangulation, poisoning, or drowning, in such case, you refer the medico-legally, and then after that you can issue.
Even during the treatment, suppose you are treating the child and child dies.
If then is suspicious condition is there, then you inform the police and you can't issue the medical legal.
For all medical legal cases, you have to demand a PM.
See, there is one more catch here.
Yeah.
What is a medical legal case, you tell me?
So wherever you have done a EPR or where you have done a police case or where you have informed police and you are not able to give a cause of death, you hand over the body to police and ask them to...
Actually, there is nothing like medical legal.
True.
We doctors have invented this term. Like we have proctologist, sonologist. There is no such degree. We have invented this word. It is the law which is applicable to doctor.
Yeah.
There is no other profession who has invented such words. There is no architect or legal, engineer or legal, professor or legal, or journalist or legal. There is no such word. They are all under the ambit of the law. But we doctors have created such words and we only get confused. We are inventing such words, right? So we are good at it. But any law where the doctor is either as accused or witness or a complainant, that case becomes a medico-legal case. So with that, now there is some informing police you are telling. What is informing police?
Just one
Yes, sir.
second. As you're discussing, sir, the medico-legal case, in a simple way, the definition is any injury to the body. That is a medical legal case. Whether it is a road traffic accident, strangulation, hurt to the body, rape, burn, whatever is there, any hurt to the body, the section comes under medical legal matters. And in that, before you can start the treatment, but you have to immediately inform the police after documentation.
Even consumer case is a medical legal case. There you are not informing police. So it is not that where you inform police it becomes a medical legal case. Medical legal case is anywhere where doctor is either accused or doctor is witness or doctor is a complainant. It is a medical legal case. That is now when to inform police. That is the question. When to inform police?
When you suspect anything, if poisoning is there, strangulation is there, and you go through the history.
So
sometimes documentation unusual date
unnatural. The word used in
Unnatural.
CRPC, that is the
Unnatural.
Criminal Procedure Code. Now they have changed the name Bharatiya Nagrik Suraksha Sahita. They have changed the name,
BNS.
keeping everything as it is. Sections are changed. That's it. To confuse us more. So it is in Bharatiya Nagrik Suraksha Sahita. What is mentioned? Any unnatural death, you have to inform. Now, what is unnatural death? To me, unnatural death is unexpected death. When you don't expect the death, you have to inform police. And we usually don't expect the death unless the condition itself is severely lethal. Right? And spiritually, if you see, sir, life itself is a lethal condition. It invariably ends in death. Right? So practically, what I suggest and what the manual suggests, that whenever there is a death, you have to inform police, let the police come and do the things. Why? And there is a Haryana, Punjab and Haryana manual. They have mentioned that any admission within 48 hours, death within 48 hours, death on table, any death which is not expected, any death of suspected poisoning, strangulation, injury, anything, you have to inform. So even within 48 hours or any broad dead patient, they have given a guideline. Now in a private hospital, you are at liberty. Suppose a child comes with, say, poisoning. Now he says, what we have to inform? Actually, we have to inform the crime. Right. Now what is crime? When somebody does something on another human being. You yourself cannot do crime to yourself. Right. So when the child consumes poison on his own, it is actually not a crime. Right? It is accident.
accidental.
But if somebody has given that poison, then it is a crime. Now who will decide that? Police will decide it. So better give it to police. In government hospital, that is why there is a norm. Every poisoning you can inform. In private, you can take that liberty. You can say that it was an accident. But burden of proof is on you. If somebody files a case, you will have to prove that it was accident and not a crime involved. Otherwise, police will try to fix you in that crime as a conspiracy. They will say that you are trying to save these people from this crime. So make it a rule always to give, inform police. Now, should we tell patient that we are going to get postmortem done? How do you inform the police, or how do you tell the relatives when the patient dies and you have to do something about this? You don't want to give death certificate. What will you do?
If we are not giving the certificate, we inform the police and
They say we don't want to do postmortem. They are ready to sign a consent.
then and then you inform the police. 100% you inform the police, and you write the written consent from the patient's relatives and explain the date of the certificate.
They don't want to do a postmortem is not an option to them. So they, once we say that we are not going to give medical certificate, means somebody has to give it, and therefore a PM is must. So we hand over the body to police. Now it is between police and them to handle the.
Very good answer. Yes, sir.
The question is when to inform police. The patient is before you in emergency room. You are not alone. There is a teamwork. So you start treatment. The other fellow will note down everything and inform the police first by telephonically, secondly by issuing a slip from the ER to the attendant, and thirdly keep a copy and record with you. The moment police comes, they will check the record and start their own proceedings. So this is the way how police has to be informed, irrespective of the diagnosis, irrespective of the media.
So, sir has rightly replied that you have to inform police, means your duty under CRPC is to inform police. It is like when you refer a patient to some specialist, he will decide what investigations to do. Once you are referring a patient to, say, a psychiatrist or a neurophysician, you don't decide CT to be done or MRI to be done. You are just referring. Similarly, you just have to refer to police. Then postmortem is a part of police investigation. You are nobody to decide postmortem to be done or not. Never take negative consent, just inform police. And also, to the relative, you say that I will have to inform police. Don't say postmortem will be done. Don't say that. Don't utter that word. And if postmortem is required, police will get it done anyhow. Or if they don't want to do, police will give NOC. Police will say postmortem is not required, whatever it is. But leave it on to police. Don't go and give death certificate. I am facing one such case. That also is just 15 days old case where the postmortem was denied. They have taken consent. They have issued death certificate. And now the relatives are telling that they have just, we were under stress. They convinced us not to get the postmortem just to suppress their crime, and we are filing this police complaint. So they have put case of forgery also against the doctor. Unfortunately, it was not a pediatrician, it was gynecologist, but this is what has happened. So please do not get trapped. Whenever it is your fundamental duty to inform police, you have to inform police. It is like when you have to brake at red light, you don't require anybody's consent, not even your wife's consent, even if she is sitting beside. Should I brake? You have to brake. That's it. Similarly, when there is a death, you have to inform police.
Hitesh
Now,
bhai,
yes.
just one minute. Police cannot give a note that PM is not required or PM is required. They have to receive the message from the hospital or doctor concerned, and the same message will be forwarded by the police to the area magistrate. And the magistrate will come and verify the facts, and after their investigation, they will say, on the basis of whatever outcome is there, whether attendant want for the PM or not want, he issues the certificate that, okay, PM is not required. Then the process starts in a different way.
So, like in Maharashtra, sir, police itself gives NOC, like police people gives NOC, and it happens. But that is their method. It is not our problem. That's it. You are clear of this problem. Now, what is the legal status of discharge on request?
Yes, you can give discharge on request.
So, what is the difference between normal discharge and discharge on request?
Normal discharge, patient is going within the normal condition, and we are sending by doctor. Discharge is given by the doctor, and discharge on request is also legally. DAMA is also legally.
DAMA is different. I am talking about discharge on request.
Discharge on request is patient on treatment but not cure. So you should inform the patient's condition of the patient's condition, explain patient is required the treatments, and you should take the written consent and
That is Dama.
Yeah, written
What
consent.
what is discharge on
So
request?
discharge is which is given by you. Discharge on request is discharge taken by the patient.
But
so the
patient-
relatives think that they don't want to continue for whatever reason and they want to go home. Here the difference is that still you don't think that the treatment is over. You want to continue, but they don't
Then
want
it
to
is
continue
Dama.
for some reason. So Dama is again different than discharge on request.
See,
Sir,
yes, sir.
as far as discharge certificate is, or discharge summary is concerned,
It has to
this is the sole document in your case, in your file before us. And discharge summary itself speaks everything. You have to mention his history and every
Everything has to be
finding,
mentioned,
everything, it has to be written over there.
Even in
clearly.
DOR, we give all the documents, but we
Besides-
would make them, we will explain them, we will counsel, we will document that, we will get a signature.
Every discharge should have signature of the
And
patient.
along with the discharge summary, all photocopy of the documents has to be given to the attendant. It's mandatory, or people are not issuing, again it becomes a legal liability on the hospital. Why you have not issued the?
Sir, in practically क्या होता है?
In practice, they are not
Practically,
issuing.
mild situation where you don't think that this is so bad, you give them DOR. When it is really bad and you really don't
I
want
will-
to give discharge.
I will
it's
tell you
Dama.
the court's view. Court has said that if somebody requests and you follow that request, it is as if you are doing that action. So discharge, normal discharge or discharge on request are same thing. If somebody requests you to do something and you do it, that you are liable for that. Discharge against advice is something where you are letting patient go against your wish. So if somebody requests you and you follow that request, you have to take full liability. You can't say in the court at that point in time that no, I was against that. Then it becomes Dama. So there is nothing like required discharge on request. Even on request you do something, you are liable for that particular thing. So remove this word discharge on request. There is nothing like required discharge on request. Whether it is their request or your wish, it means the same thing.
Only Dama. One take-home message is discharge or Dama.
Dama, yes, that's it.
And in addition to this, there is the one more term, Lama.
That is same.
And the very
Dama
legal
and Lama
term
is-
and the liabilities on doctors. Please, sir, explain this thing.
It is same. Dama and Lama is same. Either they leave or you discharge. It is same. Lama and Dama is same.
पैसा ना आपे तो लामा कहवाए.
Now,
See, Lama is, the treatment is continuing indoor status, right? And patient being taken up by the attendant without informing the doctor. And he leave the ward. So patient has gone. But you have just kept out quiet, no entry in register, no information, nothing. And here, the main thing is, if you want to save in a Lama case, inform the police immediately that so-and-so patient has left the hospital.
yeah, that is basically absconding. We call it abscond. Now, should I take one question or we should end this? Okay, very important question. I am consultant to so many pediatric units and this very frequently this happens. Child is on ventilator, relatives are not paying. Then doctor is on ventilator. Because there is no money they are giving. Now what to do, sir? How to tackle this issue?
If patient is on ventilator, you don't give Dama, Lama, anything. You are liable for that and you should explain the patient each and everything with stability.
Sir, they don't want to pay. हमारे पास तो पैसे ही नहीं है sir.
And then you can take the written form counseling with the patient and with stability with referral note. You should refer the patient to with the ventilator support, life support. You should transfer to the civil hospital.
They don't want to go. हमको नहीं जाना है.
If they don't want to go, you cannot do anything. You have to continue treatment.
Continue
So a patient
treatment
who is
and
critical-
inform the police and you should
Yes.
inform the police and take the written consent in the presence of police and all the documentation
This is
required.
very important. And which section or what makes police to help in this case?
Police, if patient...
Why police will help you?
because if patient is on critical condition and if you take the ventilatory support from that patient will maybe die within
I
the
will
hours.
give you a logic for this. What you have to tell the police. Some police officers, they don't know. Sahib, hame શું કરીએ? You have to tell, if somebody is in your premises against your wish, it is trespass. And for trespassing, you can always file a complaint. That is why you are calling the police and you are telling that I am ready to send this patient because he is not paying me. I am taking a consent, I am sending them with ventilator to a government hospital, and this is a case of trespass. And that is why police will help you. Okay, so I think that should end this panel, right? Naresh bhai is looking at me with angry eyes, so I am scared. And we will meet again on next date. It is known in the court, right? Tarikh pe tarikh.
Sir, just I think one question from your side. Event and just we are taken the insurance for the year, but one question is good. So you explain that question, sir. Event-based insurance and AOI
Claim-based policy.
Just you explain that one thing which is not knowing by the doctor sometimes.
There is AOA to AOY ratio in the insurance. What is AOA to AOY? Any 1 year, any one accident. So 1:1 ratio should be there. If your insurance is for 1 crore and ratio is 1:2, that 1 crore will be distributed in 2 incidences. So per incidence, court will give you only 50 lakh rupees. 1:4, court will give you only 25 lakh rupees. And the premium of 1:4 for 1 crore and 1:1 for 1 crore, the premium will be less in 1:4. So what agents are telling you, अरे उसने तेरे को 10,000 रुपया लिया, मैं तेरे को 6,000 में देता हूँ. But he will put ratio as 1:4. And when you actually claim, you will get only 25 lakh rupees per incidence. That is exactly happened at one girl at Vizag. And the child has died, and in that case, the claim she has put in the court is 1 crore rupees. Now, if 1 crore rupees is passed, she will get only 25 lakh rupees because ratio is 1:4. This ratio is basically invented for engineers who are making the flats. There are 10 flats, there will be 10 complaints. They can afford 1:10 ratio with 100 crore sum assured, and it will be distributed. For us, we don't have 4 incidences in 1 year. If we start getting 4 incidences in 1 year, better stop the practice and learn something. Right? We get only 1 incident, so always take ratio 1:1. Second is incidence-based policy versus claim-based policy. Previously, all the policies were the incidence-based policies. That means something happened today. You have done something today. And in that year, the child has something, some child has got something, complaint may come after 3 years, after 4 years. तुमने बचपन में ये वैक्सीन नहीं दिया, इसलिए 6 साल में इसको ये disease हुआ. If that type of complaint comes, the incidents happened at that point in time, but the complaint happened afterwards. So, if in a car insurance or something, if you are insured in that year, they used to give policy. In our insurance also previously, some 15, 20 years back, they used to give the insurance. Now, you have to be covered because the policies are claim-based policy. Claim-based policy means you should have continuous cover from the day of incidence till the day of claim. And there is something called retroactive date. When you change the policy, you have to ask your new insurance agent to put the previous date. So you have a continuous cover. If you are not under that continuous cover, you will lose the protection. No agents are telling you all this. So you have to understand this claim-based policy. All the policies today are claim-based policies.
Sir, just 1 minute, sir.
One line, we want the answer, documentation, preservation.
Sir,
Minimum 10 years. Minimum 10 years. And you scan and keep. And there is a rule of Hitesh Bhatt. What I say, you have to scan. Before destroying the records, you have to give in newspaper, 2 newspaper, one local and one the general local and one national newspaper, which should be index newspaper, that at this hospital we are destroying all the records. Those who are the original owner of the document, kindly come and collect, otherwise it will not be available after 30 days. You give that newspaper advertisement, don't give it in a very prominent newspaper like Times of India. Give it in some newspaper which only their staff reads. But it has to be index newspaper. Right? It is considered as a public notice. I am giving you all the secrets of advocate. You give it in a newspaper which should be indexed, but it should be not very popular. Give it to, and index means there is an index number, like how index journals are there. It is considered as a newspaper. Right? If you print something, that doesn't become newspaper. It is Press Council of India has approved that. That is called an index newspaper. So you have to have that kind of newspaper.
Hitesh bhai,
Yes.
small,
cases.
no question, only one advice. Right from resident to dean, they all are under this act. That is
Yes.
the Consumer Protection Act. And the liability starts from us, that is a 50 lakh. So in other words, you must have an indemnity policy not less than 50 lakh as on date.
Yes.
If you want to save yourself. And more so, try to go through this book, which will save you much. Don't get puzzled in a criminal matters where here there is no issue. But as far as consumer matters are there, you have to be very careful. And medical fraternity is almost nil in this act. And that is why they are entangled before us. And we heavily compensate and put the damages the moment it is proved. So be careful. Your indemnity should be there. You have to make your insurance a good insurance as a necessary party, not as a TPA or a private. That's all. Thank you, sir.
A big round of applause. A panel is as good as the panelists are. Thank you very much, sir, for being so supportive to me. Thank you.